being bright-eyed and bushy-tailed to hear my conversation so early in the morning. The work that I do is done through the Fund for New York City Health and Hospitals, and the work is really designed as a method for approaching violence in our city. So most of you, I imagine, are in emergency medicine, and you probably see a lot of the trauma that takes place here in Brooklyn or wherever it may happen. And so it's particularly important that you understand a methodology that we are putting in practice and in play, that you understand it, and also understand some of the components, because I think you will run into some of the people that actually help with the process. So again, the name of the project is called Guns Down, Life Up. And ideally, if we're doing what our name says we're going to do, we're trying to get our community and folks to put the guns down, and we're trying to promote life. Make sense? Easy? All right, so there are three components that are tied into the Guns Down, Life Up approach. I call it PCI. So P is prevention. So the early work that we like to do is we like to work with young people in advance of their being shot, stabbed, or assaulted. That happens typically in our model at the hospital, where we invite young people from our communities and a radius around our hospital to come into our facilities and receive all kinds of mentorship opportunities around life skills, financial services, all sorts of things that we think that would be valuable for them to kind of keep them out of harm's way. The philosophy is if we provide young people with positive things to do with their otherwise free time, they won't have time or energy to hurt themselves or hurt other people. Does that sort of make sense? So that's what we wish to do in hospital facilities around the country, and particularly here in Brooklyn and in Kings County in particular. So prevention, case one. Our long-term study, if you can call it a study, I mean it's all anecdotal, but this part we started doing this work back in probably the late 80s at Harlem Hospital, right? It was called the Harlem Hospital Injury Prevention Program. And so we've had more than 500 young people participate in this preventative work. And the nice thing about it is all these kids that have come through our program, starting in middle school and in high school, none of those kids show up in our trauma facilities. They never show up for gunshot wounds, they never show up for stabbings, and they never show up for assaults. They sometimes have come in for falls, playgrounds, monkey bars, that sort of thing, but they never come in for the penetrating trauma. So it's pretty interesting that if we can keep kids engaged, if we can keep them kind of otherwise involved in stuff that keeps them out of harm's way, they don't come into our facilities for the sorts of injuries that will probably change the trajectory of their lives. So P, prevention. So C, we call that, I call it a circle of safety. And a circle of safety is really designed to bring all of the stakeholders, people that are particularly interested in reducing injury in a particular neighborhood, to a halt. And what we do is we ask, in this case at Kings County, we ask our social worker to pull information from the trauma registry. And from the trauma registry, we know how many folks are being shot, stabbed, and assaulted. We know where the assaults are taking place. We know where the injuries are taking place. And so having that information is critical. But we also believe that there's something called community genius. And people that live in the communities where these injuries are taking place often know who the shooters are. They know the people that are wreaking havoc on the community. And they also have ideas on how to address it. So our thought is to have a monthly meeting where we invite the community into our facility to talk about it, to think about strategies that will be implemented to help address the issues, to make sure that we can stop the violence in our communities. And that has been particularly effective. So the people that we would invite, certainly we want our physicians invited. We want our hospital police invited. We want our community-based organizations invited. We want all of our clinical staff invited. Because all of your ideas, all of your thoughts, it works in a couple of different ways. It helps to inform the community what's going on. It helps us think about strategies that we can put in play to address the violence. It also lets us know what sort of outlets are available in the community. So sometimes there's some great programs that are going on that we don't know about, save the fact that we have a circle of safety so we can talk about it. And we can kind of direct families and children to places. So again, that kind of is our circle of safety. The thought process there really is to make sure that our community is engaged in our efforts to reduce violence broadly. Does that make sense? Kind of on board with that? Okay. So that's a monthly meeting. We're happy to have you involved in that. And finally, we have the intervention piece. So we've done upstream, right? We've tried to keep the kids from ever being injured. We do the community piece to make sure that everybody's involved, stakeholders are involved, and now we do intervention. So intervention is pretty interesting. That means that we kind of missed the mark a little bit. That means that somebody has been shot, somebody's been stabbed, somebody's been assaulted. They are in our facilities and they are needing our help. So as emergency medicine physicians, you already know that, when patients come back for the same sort of injury, the likelihood that they'll survive in this time decreases each single time they come back to our facility. So our goal is to talk to these young people, have a voice that they can listen to, a voice that they will recognize, and say, hey, let's talk about what happens when you get shot, stabbed, or assaulted. Does it make sense to retaliate? Probably not. Do you know what happens should you have children, do you know how that affects the possibility of your child and their future? All those conversations can take place at the bedside because we invite a family of folks that we call cure violence or hospital responders into our facilities. Folks who have lived in the communities, folks who have probably wreaked havoc at different times in their lives in the community, folks who've probably been shooters, folks who have likely been incarcerated, who have elected to change their lives, change the trajectory of the things that they wish to do, but rather than hurting the community, they wish to help. These men and women are invited into our facility to talk to our patients when they're stable, to redirect their thought about how they will respond once they come out of the facility. Is the response, I'm gonna tell my boys to go get that dude that shot me? Or is the response, no, fall back, it's not good. Most of these men and women that come in as our hospital responders have lived the life that many of our patients have lived, have been shot, have been stabbed, have been assaulted. So they speak from a voice that our patients can listen to, that they respect. They're considered credible messengers for that very reason. Their voice is respected and heard by our patients. We invite them into our facilities. We invite them to work out in our communities. They come to our Circle of Safety meetings. All of this is done in an effort to reduce retaliation and really to break the cycle of violence. And it's very, very interesting. When you have an opportunity to have a caring voice, when you're given an option to do something different, sometimes, not in every case, but sometimes people make the choice to do differently. And many times there's a caseload that this hospital responder will take on to help redirect our young people to activities that, again, will keep them out of harm's way, to be engaged. Sometimes it means finding employment for them. But the long and the short of it, the game plan is to make sure that our young people that are injured in this way do not become re-injured, and they are not the instigators of violence in other places. Does that make sense? So the philosophy, again, has three components. There's a preventive component, there's a community component, and there's an intervention component. We believe that this work is best served in hospitals because hospitals really are the cornerstones of communities. Everything actually flows through the hospital. Every person in the radius of this facility, comes to this facility for something. And we can be a beacon of light, a beacon of hope for the community, and the community knows that this is a safe space for children and for adults. Then I think we begin to address violence in a way that's a little bit different. Because unlike many people in the world, we see this as a public health issue. It's not a policing issue. I mean, you can try and police this all you want, put everybody in jail, but that doesn't help the situation. But if we address it as a public health issue, as it is, I think that we think about it differently. We think about how we tend to our patients. We think about what happens once they're released. I think that the world begins to have a different perspective, and the thought process is done a little bit differently. And which is particularly why our clinicians, our physicians are critically important, and you need to know that this sort of process is happening. Certainly it's happening throughout all of New York City Health and Hospital facilities. There are 11 of those. And there are affiliate organizations around the city and outside of the city. I mean, in Cleveland, they are actually adopting this process in the Cleveland Clinic and some of the other hospitals that are in Cleveland. The point is that we think that we're onto something that makes sense. Again, it deals with stuff that's upstream and downstream. And ultimately, we hope to look to reduce the number of injuries that take place. And like it or no, New York City is recognized as the safest big city in the world. We have our issues. But relative to some other places around the country, I think we do a really, really fantastic job of helping to address these issues. And there's a whole other component of work that goes on with our peer violence partners that they kind of segment, or they identify, they geo-identify an area which they will put services in place to kind of help reduce injuries, and we identify, you know, where the highest rates of injuries are taking place, and we try to address those injuries that way. But like I said, there's a full practice that's tied in, and I was told that I only had 15 minutes to kind of share out with you what I needed, because I know you're busy, you have a bunch of other things, but I wanted to give you an opportunity to ask questions if you need to. But PCI, Prevention, Community, Intervention, the program is called Guns Down, Life Up, and my name is Eric Payette.